A very good afternoon to you and many thanks for joining us. You're watching news updates coming to you live on Politics and Business Television Abuja. I am Fatima Abubakar Oyibo. On the news at this hour, the federal government is racing to prevent a nationwide strike as the Minister of Labour and Employment, Muhammadu Dingyadi, rescheduled a crucial conciliation meeting between the Dangote Group and the Nigeria Union of Petroleum and Natural Gas Workers, NUPENG. Originally set for 3 p.m. on Monday, the meeting was moved up to 10 a.m. in Abuja. However, union leaders and other stakeholders were still in Lagos at the time, delaying the start of talks. The meeting comes amid rising tensions over alleged anti-labor practices at the Dangote refinery. NUPENG has accused the company of suppressing union activities, offering substandard wages, and preventing drivers of newly imported CNG trucks from joining industry unions. The union insists these actions violate Nigeria's constitution, the Labour Act, and international labor conventions that guarantee freedom of association. Officials say the goal of the meeting is to avert a shutdown of petroleum operations which could severely impact the economy. The Ministry of Labour has confirmed that discussions will begin once all parties arrive, and it remains hopeful that a resolution can be reached to restore industrial harmony and protect workers' rights. Meanwhile, Nigeria's health sector may face a major crisis if the planned nationwide strike by the Nigerian Union of Petroleum and Natural Gas Workers goes ahead. Minister of State for Health, Dr. Isiaq Salako, has raised alarm over the potential impact, warning that most hospitals rely heavily on fuel-powered generators for electricity. He says any disruption in fuel supply could severely affect medical services across the country. Speaking on a live television program, Salaka urged both NUPENG and the Dangote Group to exercise restraint and prioritize the welfare of ordinary Nigerians. He emphasized that the strike could disrupt not only healthcare delivery but also broader economic and social activities, calling for a balanced resolution that respects both workers' rights and national interests. The minister acknowledged Dangote's role in boosting domestic capacity but stressed that union rights must be protected. He appealed for dialogue and compromise, warning that the consequences of a shutdown in the petroleum sector will be far-reaching and deeply felt by vulnerable communities. In the meantime, the Nigerian Civil Aviation Authority has announced a bold new enforcement strategy, publicly naming and shaming airlines that violate aviation regulations, especially in cases of flight delays and cancellations. The move comes amid growing passenger complaints and rising incidents of unrest at airports, often linked to poor service and regulatory breaches. In a statement posted on Monday, NCAA spokesperson Michael Achimogo stressed that passengers stranded between 10 p.m. and 4 a.m. due to flight disruptions are entitled to hotel accommodation fully paid for by the airline. He condemned the recurring practice of airline staff abandoning terminals during such incidents, leaving NCAA officials to manage a frustrated crowds alone. He warned that this behavior will no longer be tolerated. While acknowledging the operational challenges airlines face, the authority insists that these do not justify neglecting passenger rights. Achimogo emphasized that any airline choosing to operate in Nigeria must meet regulatory standards and deliver quality service. The NCAA says it will now enforce strict compliance and apply full sanctions where necessary, in line with directives from the federal government and the Minister of Aviation. Now on business matters, the Nigerian Customs Service Board has approved a new de minimis threshold of $300, allowing duty-free clearance for low-value imports, e-commerce, shipments, and passenger baggage. The policy, which limits such exemptions to 4 importations per year, was ratified during the board's 63rd regular meeting chaired by Finance Minister Wale Edo. Customs officials say the move aligns with both national legislation and global trade standards, including agreements under the WTO and WCO. Under the new framework, Qualifying goods will be cleared immediately without post-release documentation, provided they are not restricted or prohibited. Customs authorities have warned that any attempt to manipulate invoices or evade duties will attract strict penalties, including forfeiture and arrest. To support smooth implementation, multi-channel help desk will be launched to assist stakeholders with compliance inquiries and complaints. In other developments, the board addressed disciplinary matters involving misconduct by some officers. Following a review, 2 personnel were demoted to lower ranks, while 2 others were reinstated after their cases were reconsidered. Officials say these actions reflect the service's commitment to integrity, accountability, and ethical standards. On the foreign scene, regional and global health experts have converged in Abidjan, Cote d'Ivoire for the second ECOWAS Lassa Fever International Conference, which of today. The 4-day event organized by the West Africa Health Organization is themed Beyond Borders, strengthening regional cooperation to combat Lassa fever, an emerging infectious disease. It builds on the inaugural conference held in Abuja in 2019, making a renewed commitment to tackling one of the West Africa's most persistent public health threats. The conference features plenary issues, expert panels, workshops, and research presentations, all aimed at developing a regional roadmap to improve access to diagnostics, vaccines, and coordinated disease control. LIC 2025 seeks to foster multi-sectoral collaboration and long-term solutions for Lassa fever and broader health security challenges. Stakeholders from across the continent and beyond are expected to share insights and strategies to enhance preparedness and outbreak response. Back in 2019, the first conference commemorated 50 years since the Lassa virus was first identified in Nigeria. That milestone brought global attention to the need for integrated approaches linking human, animal, and environmental health. Participants then and now continue to call for increased investment in research, improved surveillance systems, and expanded laboratory capacity to ensure timely diagnosis and effective response to Lassa fever across the region. That will be all for now. I'm Fatima Abubakar Oyibo. Do have a lovely day and bye for now.